You know, about 1 in 7 men will be diagnosed with prostate cancer during their lifetime, so it's important to know about early detection and the available treatments if you need them. With us is Dr. Damon Smith from Genesis Healthcare Partners. Good morning. How are you?
Good morning. Doing well. Thanks. How about yourself?
Great. First off, I'm going to tell you, prostate cancer, the idea of it scares me, my family. It runs extremely strong in my family. And so I really want to learn about these new genetic tests that you were kind of telling me a little bit about earlier off the camera.
Right. So the issue is that the death rate from prostate cancer is declining, but we know that there are a lot of men who we treat that we didn't really need to treat. And so what we do now is we divide men based upon a number of clinical factors into low risk, intermediate risk, or high risk disease.
Okay.
But within each of those risk categories, we know that some low-risk cancers are actually very aggressive, and some high-risk cancers are actually not that aggressive.
Okay.
And so what these genetic tests do is they let us look in a new way at each man's individual cancer based on the biopsy. And they basically let us know, what is this cancer thinking? So a lot of prostate cancer is actually pussycats. And so right now in our practice we're following 35 to 40% of the men who we diagnose with prostate cancer, meaning we're not treating them. We're actively observing them and seeing what they do. But what these tests do is they let us know, is this a pussycat or is this an MMA fighter that you're going into the cage against?
Okay.
So it's a whole new way of looking at prostate cancer for us.
So I have an enlarged prostate. I've shared this before on television, and my doctor has told me that some guys just have that. And they monitor that.
Right.
Now, at first glance, I remember him saying to me, "Hey, it's enlarged. Let's get you tested." I'm a little concerned, and then he realized through several other tests throughout the next year and a half, he says, "You know, that's just you. We'll just monitor."
Right.
So that sounds right.
Yes, definitely. Yes.
So what if whatever the percentages of men that need the treatment, there's all kinds of new treatments, like a cyber knife and robotics. And
yes,
tell us about that.
Yeah. So I think most people are familiar with robotic surgery, which has really helped with diminishing side effects and diminishing hospital time for patients with prostate cancer who get surgery. We also have non-invasive ways of using robots now, where we deliver the radiation using a robotic arm. And the nice thing about that is that the treatment's done very quickly. It's done in just a week, rather than the typical 8-9 weeks that can be necessary when using other treatments. So it's a big advance.
This is exciting to me because tell me if I'm wrong here. I get worried about sometimes doctors going, "Hey, this is the norm over the years I've been practicing, and so this is how I'm going to treat you." Just a general treatment because it just seems to work better than anything else that I know about. Keywords that I know about. But you are on the cutting edge, and it seems to me that you and the doctors in your area with Genesis Healthcare, am I right? It's more specific.
Yes. San Diego is actually a good place to be if you're going to have this, because there's a lot of expertise in the community. My colleagues are some of the foremost in robotic surgery. We actually pioneered robotic radiosurgery in San Diego County, so we have pretty much every option available, I think, to men within this community.
Now, what are we looking at here? I'm looking out here at the screen. A Prolaris stratification. It's funny that I could even read that.
Right. Yes. So that's what that shows is the risk categories. So the lower line is the low risk. The upper line is intermediate risk. The middle line is middle risk, and then the upper line is high risk. But what you look at is each one is a click, and so as you go to the right, it means there's higher risk categories. So you can see, as we were talking about earlier, that some of those low risk patients actually have very aggressive cancers.
Right, so you watch it more closely.
Well, and with these genetic tests, we know, oh gosh, this is one that even though it looks pretty benign and pretty friendly, actually this is something that is going to behave very aggressively.
Okay.
And likewise, with the intermediate risk, it helps us to know, well, is this that pussycat or is this that MMA fighter you're going against?
So again, you're going by the individual, which is so much better.
Right, it's personalized medicine come to the treatment of prostate cancer. So it's a big advance.
Dr. Damon Smith, Genesis Healthcare, thank you so much.
Okay, my pleasure.